Health and hygiene. What is a disease? An illness caused by an infection or a deficiency is called a disease. A disease causes some harmful changes in the body called symptoms. They interfere with the normal functioning of the body. The symptoms indicate the particular disease a person is suffering from. There are different types of diseases. In your previous class, you have already learnt about deficiency diseases caused by deficiency of different nutrients in our body. Now, we will learn about some diseases that are caused by harmful microbes. Microbes are tiny living organisms that cannot be seen with the naked eyes. They can be seen under a microscope. They grow and multiply rapidly and may spread various diseases. Know this. According to WHO, health is a state of complete physical, mental, and social well-being and not merely an absence of disease or infirmity. Over 30% of cancer could be prevented by avoiding tobacco and alcohol, having a healthy diet and physical activity. Microbes. There are 4 kinds of microbes: bacteria, protozoa, fungi, and virus. 1. Bacteria. Bacteria are the most widespread organisms on the earth. They are found everywhere in air, water, and soil. They also live on dead matter or living things as parasites. 2. Protozoa. Protozoa are bigger than bacteria. Most of them live in water. Others live as parasites in the bodies of plants and animals. 3. Fungi. Fungi are plants which lack chlorophyll. Hence, they cannot make their own food. They live on decaying matter as well as living plants and animals. Dark and damp places are suitable for their rapid growth. 4. Virus. They are found everywhere. They become active when they enter the body of a plant or an animal. Diseases caused by microbes. There are some types of bacteria, protozoa, fungi, and virus that cause various diseases. Table 4.1. Some diseases caused by different microbes. Microbes, diseases. Viruses: common cold, influenza, mumps, hepatitis, chickenpox, measles, polio, viral fever, rabies, dengue fever. Bacteria: pneumonia, tuberculosis, cholera, typhoid, leprosy, tetanus, plague. Fungi: ringworm, athlete's foot, itching. Protozoa: malaria, sleeping sickness, dysentery. Types of diseases. Some diseases are transmitted through air, water, and contact, or through animals as flies, insects, mosquitoes, etc. On the other hand, some diseases are not transmitted. On the basis of cause of spreading diseases, it can be of 2 types. 1. Communicable or infectious disease. 2. Non-communicable or non-infectious disease. Communicable diseases. The diseases which spread from infected person to a healthy and are caused by microscopic organisms that attack the body are called communicable diseases. The media of spreading these diseases are air, water, food, contact, and insects, etc. Examples: malaria, cholera, tuberculosis, AIDS, etc. Non-communicable diseases. Non-communicable diseases are not communicated from one person to the other and do not have or are not known to involve infectious agents. Examples: rickets, hypertension, arthritis, etc. Modes of transmission of diseases. The communicable disease may be transmitted through the following methods: water and food. Diseases like cholera, dysentery, typhoid, and jaundice spread through infected water and food. Flies, rats, cockroaches, etc. can infect food and water with the harmful microbes that cause these diseases. Food and water also get infected with disease-causing microbes when they are handled with dirty hands or kept in unhygienic conditions. When people eat or drink this infected food and water, the germs enter their body and cause disease. Air. Diseases like influenza, pneumonia, chickenpox, and common cold spread through air. When a person infected with one of these diseases coughs, sneezes, or spits, disease-causing microbes come out of the body and spread in the air. On breathing this air, a healthy person may be infected by the disease. Direct contact. Diseases like ringworm, chickenpox, etc. spread through direct contact. If a healthy person uses clothes or other things of an infected person, he or she may get infected by the disease. Insects. Diseases like malaria, dengue, and plague spread through insects. Insects like mosquitoes and fleas spread these diseases. Female Anopheles mosquitoes cause malaria in human beings. When a mosquito bites a malaria patient, it carries the malaria-causing microbes in its body. When the same mosquito bites another person, the malaria-causing microbes enter the person's body and cause the disease. Plague is transmitted by the rat fleas. Disease is a condition that results in medically significant symptoms in a human. Symptoms, precautions, and remedies. Some communicable diseases, their symptoms and precautions are given in Table 4.2. Diseases, symptoms, preventions or remedies. Common cold, sneezing, headache, chilling, sore throat, inflammation of the nose, running nose. The patient should cover the mouth and nose while coughing and sneezing. The patient should take enough rest. The healthy person should avoid a close contact with the patient. Influenza. Sudden and distinct chills, fatigue, muscular ache all over the body, high fever, coughing and sneezing. The patient should cover the mouth and nose while coughing and sneezing. The patient should consult a doctor and take bed rest. The healthy person should avoid a close contact with the patient. Mumps. Swelling of the salivary glands, painful chewing and swallowing, feverish cold. The vaccination during childhood provides immunity from this disease. The person once attacked by the disease usually gets lifelong immunity. Chickenpox. Eruption of blisters on the skin, itching. The patient should be isolated and confined to bed and avoid scratching the blisters, which can otherwise cause scars on the skin. The vaccination during childhood provides immunity against the disease. A healthy person should not come in contact with the patient or the things used by the patient. Measles. Fever increases with the red spots on the body, runny nose, congestion of the mucous membrane of nose and throat. The patient should take rest. The steam inhalation gives the patient relief from the throat irritation. Vaccination during childhood provides immunity against the disease. Dysentery. Watery stools that may contain blood, abdominal pain, vomiting, dehydration. The patient must consult a doctor immediately. The patient should take hygienic liquid food. The patient should not eat food with unwashed hands. The patient should not eat or drink stale and infected food and water. Should take proper sanitary measures. Pneumonia, headaches, feverishness, muscle pain, coughing. The patient can generally recover with the help of antibiotic drugs, but it should be done only after consulting a doctor. Ways to prevent communicable diseases. 1. The best way of preventing the spread of the infectious diseases or communicable diseases is by keeping the surroundings clean. 2. Germs, flies, cockroaches, mosquitoes breed on garbage. So, garbage should be disposed properly. 3. Keep ourselves clean. 4. Houses should be airy, clothes and bedding should be left in the sun from time to time. Sunlight and fresh air should enter the room as they kill germs. 5. Mosquito repellents must be used to protect ourselves from mosquitoes. 6. Keep the kitchen clean and germ-free. 7. Drink clean water and eat fresh food. 8. An infected person should be kept separately. The clothes and room of the patient should be kept clean using a disinfectant. Many diseases like measles, polio, tetanus, tuberculosis, and diphtheria are controlled through immunization or vaccination. Immunization is a method through which a vaccine is injected or given orally to make the body resistant to a particular disease. Hygiene. Hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. It is important to maintain personal hygiene and the cleanliness of the surroundings to prevent the spread of diseases. Hygiene is the science dealing with the preservation of health. Maintaining personal cleanliness. Personal hygiene. Cleanliness is the freedom from dust or impurities. We need our body, clothes, house, and surroundings to be cleaned thoroughly and regularly. In dirty conditions, many germs attack and the chances of infection increases. These infections can cause some disease. Personal cleanliness is the most essential for good health. It is always better to remain under hygienic conditions. To maintain a good health, following suggestions should be adopted in our daily routine. 1. Wash your hands frequently. Before taking meals, hands should be washed by soap. 2. After taking meals, wash your hands and brush the teeth to remove small food particles. 3. Regular bath must be taken to clean the skin and entire body with a good soap. 4. Change your undergarments and other clothes daily. 5. Keep the nails short and clean. 6. Eyes should be washed by clean water twice or thrice daily. 7. Ears should be protected from dust. Do not use unhygienic objects like matchsticks to remove earwax. Soft medicated buds should be used to clean the ears. Maintaining cleanliness of the surroundings. Public hygiene. By adopting the above-mentioned methods of personal cleanliness, you can keep yourself healthy. Sometimes, even after taking most of the precautions, you get sick. Can you understand why this happens? Most of us keep our home clean and maintain the hygienic conditions. Some of us have unclean personal habits, which make it difficult to maintain a healthy environment. You may be clean, may be eating balanced diet, and have healthy atmosphere at home. But what will happen if your neighbor dumps garbage in the open? What will happen if drinking water supply is not clean? These unhygienic conditions may produce disease, causing microorganisms and you may get infection and fall sick. Thus, unhygienic personal habits can create health problems for you and the entire community. The following precautionary measures should be followed for the health of the whole community. 1. All public places such as the schools, office buildings, bathrooms, lavatories, cinema hall, etc. should be kept clean. 2. The eating places such as hotels, restaurants, dhabas, and their surroundings must be kept clean. All eatable items must be kept covered. 3. All public drains and garbage must be covered and some disinfectants should be used. 4. Water should be kept free from germs and microorganisms by using chlorine or bleaching powder. 5. Spray disinfectants over stagnant water so that the mosquitoes do not breed over there. 6. For sewage disposal, proper dumping method should be followed. Waste materials should be dumped in pits, techniques of composting and sewage treatment plants should be installed. 7. Avoid defecating in the open. 8. Trees